I appreciate it. Thank you so much, everyone, for joining me today. I'm really excited to talk about voice in private practice. I feel like almost like a child on Christmas morning, because I feel like we're on the precipice of something really exciting within healthcare. And I'm really interested in showing you a little bit of my journey of using a voice and how I'm incorporating lean methods within care. I have actually been in private practice in North Bergen, New Jersey, in my dental practice for 20 years. And during that time, I've constantly evaluated what can I do to improve care within my office. And once voice became part of my arsenal, we were off to the races. As someone who consults regularly with other doctors and dentists about technology and how to incorporate new exciting ways of doing care in our office, we often get requests for people to come in and do patient tours of our office. And in one particular occasion, we had a dentist come in and we gave him a tour of our office. We showed him our digital radiography that emits 80% less radiation than normal x-rays. We proceeded to show him our digital scanner that we have that allows patients to have impressions taken without using those gunky trays with impression material. We also show them how we use Google voice to text to be able to document our systems in our office. And he looked at me during all that time and seemed very impressed with how we were incorporating things and overcoming bottlenecks in our office. But then he paused and asked me, "This is all great, but how is this improving your return on investment? I see you have a digital scanner that costs thousands of dollars. You use digital radiography that costs equally quite a bit of money. And this is all nice, and for patient optics, it's great. But how is it actually helping your bottom line?" And my response to him was, as healthcare professionals, we are not necessarily incorporating technology for patient optics or return on investment, a singular reason. We're looking at the composite of how we practice dentistry. And we must practice and define values from the patient perspective. A patient is not going to plead with me to ask me to incorporate technology. Many times they don't know how it's going to benefit them. It's up to us as practitioners to be able to learn about what's available and apply those things to our office. And identifying those problems is a team approach. A holistic approach to improving healthcare through technology is really what's going to make the 21st century of healthcare one of the best. So how do we get there? So in our office, we have core principles that we follow. We want to follow best practices for patient care. We're interested, obviously, in being HIPAA compliant. Safety and saving time is important. But we want to allow each person in the office to be treated equally. One person isn't any better than another because of a degree. We want them to feel like they can speak up and tell us what they think could solve problems. We also want to work with companies that have alignment with just the patient and the staff, not one or the other. And we want to make sure we're moving resources to the patient as opposed to having to go somewhere else to get the patient's information or resources. Having everything right there for the patient allows us to give even better care to our patients. We consider all these factors as extremely important because each time that a patient comes into our office, we're evaluating every touch point that they go through, from the moment they're at home to deciding that they have symptoms, to when they come into the office, to when they come and go home and get care taken care of and continued at home. Traditionally, we've looked at healthcare as being only within the four walls of our office. But I would challenge us to start thinking that healthcare actually starts when a patient is at home. When a patient starts thinking about an issue that they have and the symptoms and why they want to go to see a dentist, they think about this when they're at home. And we're seeing more and more that people want to incorporate voice to find out more about their conditions. We know as a family, we have many symptoms that can possibly come up. And being able to try to address those by using different methods is the way that we're going to feel confident when we go to see our provider. We also know that women make a majority of the healthcare decisions. And many times when they make these decisions, they're trying to figure out what is the best way to proceed prior to even being in the office. So what is she thinking about? She's thinking about symptoms that she has, medication information, where the hospital or urgent care facility is. And she wants to research treatment options prior to going into the office so that when she's presented with treatment options, she can firmly make a decision as to what she wants to do to proceed forward. We see that voice assistance is the way that we can deliver this care even better. As a team, when COVID-19 came upon us, we realized we needed to really think clearly about how we were going to incorporate changes going forward. We knew that patients were going to want to be taken care of in a different way, and we had to make that visible and over-communicated to them so they knew exactly what type of care they were receiving. Making these changes alone wasn't going to be enough. We had to actually show those changes and illustrate them in many ways. So we incorporated what we consider to be lean methods within healthcare and the value stream mapping. How do we do this? We use Post-it notes to document either different touch points within the office and how we would address them. We saw a pattern constantly coming up of questions that patients had and concerns that they had, and we took the top 10 and addressed them. For instance, patients were constantly worried about contactless interactions. So we actually had our waiting room in the cars and texted them when they were ready for their appointment. We knew mask removal, which is important in our industry because we're constantly dealing with the mouth, would be required. And how are we going to address that so that we're not contaminating different areas of the office? And we had to make sure that we were over communicating to the patient so they knew we were being vigilant. We weren't taking this lightly. We wanted to make a difference. We wanted to make sure that they felt like they could take care of their dental care during this tragic time. So we constantly were maintaining that communication. And to add to all of that, we had reduced staffing. Many people did not want to return to being in the dental care field. So how are we going to address these changes that we were seeing? By doing value stream mapping, we were able to find what the bottlenecks were and discover ways as a team coming together as to how we were going to overcome them. And we mapped it out and came up with some great solutions. We came up with what we consider to be the aesthetic dental skill. It's patient focused. And the first touch point, as I mentioned before, is when patients are at home deciding to have their health care done, deciding to go to a dentist, trying to figure out who is the best dentist in their mind. And so we're constantly addressing the patient's needs and what they need. We included information about the office in this voice skill. We gave patient FAQs, and we standardized consent. And checklists were extremely important as well as in our office, but we let patients know what we were doing in our office to mitigate any risks of COVID-19 transmission. Patients were really pleased with this, and it was very helpful. We also understood that HIPAA compliance is extremely important. And then to address all of this, we made sure that patients had access to the skill on their phone so that the skill was not initiated within the office, but either behind closed doors or on their phone. So they were fully in control of what was happening. Now here is an example of how we use the skill to actually tell patients about what a root canal is.
What's going on? Did you know you can ask me what I do to get ready for a show?
What is a root canal?
Inside your tooth, beneath the white enamel of a hard laminate dentin, is a soft tissue connective. This tissue contains blood vessels, nerves, and connective tissue, which help grow the root of your tooth during its development. A fully developed tooth can survive without the pain because the tooth continues to be nourished by the tissue surrounding it.
So as you see, this is an example of us explaining the treatment to the patient. We made sure we kept it in text form so that the patient could be able to see the words as they were being displayed on the phone instead of putting an image. And we thought about also that patients would also get this in written form handed to them. But what this enabled us to do is give patients information prior to coming to the office and when they were in the office. And they would learn more about a procedure that they were concerned about and how it was going to be addressed. We also realized another touch point within our office was staff training. Patients wanted to be able to have training done on a regular basis by the actual office and be able to see the training that was being done. So staff, all of a sudden, were being forced to use expanded PPE. They were also being cross-trained to do different jobs because of the reduction in staff. And we wanted to be able to show the patients that we were on top of our game. And one way we could do that was offering staff training on our skill. So in a moment's notice, without having to remove all of our gloves, all of our PPE, we will be able to show patients as well as give the team an opportunity to learn about the very techniques that we were doing in our office. Within dentistry, we're very technique sensitive. And so we have to be able to show the staff by showing them the videos of what they need to be able to do so that they can actually follow each step as it's going. It's very technique sensitive, and we found that this was actually able to help patients quite a bit by incorporating it within the skill. Having firm product knowledge and understanding accuracy was critical, and this allowed us to do that.
Okay, here's what you need. Hi, I'm Ikemeter. I can read your mind. Think of a character. I will try to guess it. Are you ready? Sorry, I did not catch that. Hi, I'm Ikemeter. I can read your mind. Think of a character. I will try to guess it. Are you ready?
Dr. Durgam, if you can turn the volume up on the videos, if there's a way to do that.
Okay. So this just gives an example of basically the training that we were able to do within the office and showing patients and staff what are the different steps that are needed to be able to take care of treatment. And because of its accuracy and because we know that it's not going to be information that's being moved from one person to the next, we know that every time that somebody looks at this, they're going to get proper information. Another thing that we looked at as a touch point within our office is how to maintain inventory. So in our office, we're considering everything that we're looking at and how we're going to make sure that we use visual management to make sure things are taken care of. We no longer want to take our gloves off to deal with anything within the office. What is the easiest way that we can manage inventory without it getting out of control, without it being neglected? And so what we decided to do was do what we consider to be the Kanban system of supply management. We put all of our inventory within these plastic bins that allows it to be visual. And we let our staff on a regular basis notice that when it goes below this black line on the actual plastic bin, that is the time to order. We're basically allowing ourselves to only order once a month, and we're making sure that the supplies that are needed are available for patients when they need it. This is constantly being able to be monitored, and it allows anybody in the office to monitor it, not just one person. Currently, right now, many offices actually dedicate half of a day to actually monitoring their supplies. They go through their cupboards, they go through different areas in their office to see what is being low in terms of stock, and then they go ahead and they order it. This allows us to do it as time goes. So we're not necessarily dedicating 3 or 4 hours of staff time to do it. And from noticing when something is visually not available, we actually tell our voice assistant what is needed, and we put it on a list. In addition to that, we order office supplies through Amazon Pay and use our actual Alexa device to do that as well. This has been extremely helpful in not only maintaining things that are missing within the office, but also maintaining a list of repairs that are needed as it's happening real time. At the end of the month, we actually look at those lists and then we move them to our software that allows us to use an ability to look at things from a cost perspective, expiration dates. And so it's really a bridge between voice and software. Now, it's not a total win in terms of using voice completely from beginning to end, but because our industry is very strict in terms of standards and how we manage supplies within dentistry, and to make sure that supplies are not going from a gray market to an office, we have to work with what we have, and we found that this is a good solution. Another concern that we've found that many people are concerned with Amazon being a competitor, and so many inventory warehouses are not interested in working right now with a device like Amazon. So eventually it should become private in terms of how we use inventory control and try to manage it within the office. So as we're using this visual signal to tell us about how and what we need in terms of inventory, we're also realizing that we're able to source all the information in one area. And this is critical because when patients need treatment right away and they decide all of a sudden that they need a crown, we need to make sure the inventory is readily available. Now when we go to see the patient in the room and they decide that they're ready to continue their care at home, many times patients' parents will come to us and ask us if we can actually, as providers, talk to their patients, okay, talk to their kids, because they want us to be able to tell their kids what is needed and why they should have treatment done and why they need to take care of their teeth. Parents will plead with me, please, Dr. Durgam, could you tell them to brush their teeth? Because when I tell them, they don't listen. And as much as influence as I wish I had, it's not really something that happens regularly where kids are actually listening to me for 365 days. So one thing I had to consider through my whole mapping of my system is that this is something that came up quite a bit, that children could not take care of their own teeth unless somebody was constantly reminding them to do so. First of all, we have to be honest that many people don't like going to the dentist. Secondly, we need an issue of compliance, understanding that the provider needs to start taking onus on compliance. It's not enough for us to tell a patient, okay, you need to follow these set of instructions when you get home, and then everything's gonna be fine. And then criticize them 6 months later when they come back and they're not doing it. So what is the solution? The solution is, for me, was to start developing toothbrushes that I gave to patients with a particular code on it, which they can then use on my voice skill to open up daily instructions as to how to brush their teeth. And this is important because this is another way that then children can learn and they can actually get different information that they wouldn't ordinarily get. And not only that, it's personalized. It actually contains my voice. And let's take a listen as to what is one way that for young kids, we've asked them to brush their teeth.
I'm not hearing that.
Okay.
It's very faint.
Okay. So we made a set of videos for children to use. We can also adapt different information that they can use. And why we think this is important is because when children wake up in the morning, if they have their Alexa device next to them as they're brushing their teeth, they can get daily information and daily challenges We also developed a scavenger hunt that children can use to learn more about dental care and get them interested in gamifying the process of brushing their teeth. Now, instead of talking to patients twice a year, I'm talking to them 365 days a year, which really changes the dynamic of my interaction with the patient, and also changes it so that when they come into the office, I already have a feel for what they've been doing in terms of compliance because of the interaction that I'm having with them on the skill. Additionally, there's other ways that we've been doing this, but this is one that we've found that has been extremely helpful. And it's not only helping kids, it's also increasing my treatment success and making me feel satisfied as a provider that I'm actually making a difference in improving oral hygiene for my patients. To go a step further, now that the patient is leaving the office and going home, I've realized that it's important for me to continue also giving them information, but also letting them know more about myself. Trying to meet the patient where they're at is all about what is lean care, and actually making sure that the patient feels that they understand and feel at home with their provider. And one of the ways that we did this was trying to incorporate more and more in terms of personal branding, constantly giving value, constantly sharing tips about my life. And I know that for some right now in the medical profession, it's a bit controversial about what we should share on social media with given articles that have come out recently. But my feeling is that personal branding is important because it gives us a platform as providers to address issues that continually come up. When I know that a prominent doctor on their television show has started talking about something which I may not agree with as a provider, I have an ability as a provider on my voice skill to actually alert my patients of what my viewpoint is on it because I have a platform. If any negative information gets out, I now have a way of communicating that prior to the patient coming to the office. Now I've actually been able to spend more of my time within the office about actual treatment for that individual patient instead of broad questions that they have and hearsay that they've learned on the internet or from people on television. And this is another example of something that we have done within the office in terms of personal branding with my voice skill. So it just gives an example of different ways that you can actually start personal branding and helping yourself actually also closing the gap between you and your patient and developing a better rapport. I will say 9 times out of 10, when patients are referred to my office, they know quite a bit about me before they came to the office. I'm attracting patients who are actually interested in me, interested in the way that I provide treatment, and are already on board with how I do things, which actually makes things so much easier as a provider, knowing that you're attracting your tribe. And so I think it's extremely helpful in doing personal branding on the voice skill. And we're really meeting patients where they're at with doing voice as opposed to any other platform. Now with this, I've been able to now start using my platform and personal branding to talk about my products and services. I'm doing pre-dental consulting. I'm also helping in developing products and a podcast, which is a voice skill as well for dental exams for students who are getting into dental school. And so we're able to help those who don't ever have other options of getting help in terms of preparation for school. We're offering that, and we're able to use my personal brand skill to then obviously advertise it further. And so all of these things come together to help because they're helping different products and different things that we want to do within the office, as well as secondly, helping also my personal branding and personal products that I'm trying to let people know about. And it's been quite a ride actually by using the voice skill. So where do we stand then with everything that we have? So going back to what we were talking about earlier in terms of how we were addressing patients and what is it that they wanted. Well, we know that they want care and they want to be able to address things with voice. We also know that we need to, as healthcare professionals, meet patients where they're at and adopt principles that are going to help overall with care, not necessarily help singularly one topic or singularly help with return on investment. We're able to, through voice, actually fulfill our mission of providing better KPIs across the board, not just one or the other, but every little aspect of our office. We've reduced wait times by 50% in our office. And the most that a patient has waited at this point is about 5 minutes. We've improved efficiency within the office. We've improved wow customer service, because now patients, when they find out about me, they actually know what to expect in terms of when they come to the office. They're going to receive a patient tour. They're going to learn information using their voice skill. And so they're really excited that they're actually working with an office that's technologically advanced. Our team members are happy because they're part of the process. When we were doing the value stream mapping, they were the ones to identify the problems and tell me about what we could do within voice to apply it to the problems that we faced. We were also able to decrease paper consumption within the office. Now, most of the information that they receive is also through the voice skill or through digital papers that they're sent. We're also able to improve treatment outcomes, and we see this across the board based on the reduction in carries and also in terms of looking at patients and what their needs have been. They've actually been more willing to go forward with treatment. They're less likely to leave bigger problems more than 2 weeks. And so this has dramatically changed the way that we have practiced dentistry. And so for me, what I ask, and this is something that I think all of us could start to consider as a challenge, is how do we all think about our own institutions or our own practices, and how can we improve care? Because this is extremely important. We need to start incorporating everything that we can in terms of technology within our arsenal of items that we can use to actually change healthcare for the better. And by bringing our team along, we're actually improving the composite of care, not just one aspect of it. And I think if we all go to our institutions and all of us look at our practices, we can actually find areas where we can use technology and voice to improve it. And I appreciate your time. Thank you so much. It's such a pleasure, and I always appreciate Bradley for inviting me to be part of this conference. So thank you so much.
Dr. Durgam, that was great. So what I'm going to do, I'm going to hit reclaim host here. And I'm going to, oh, you know what? I figured this out last time. If I hit this right here, stop sharing. Okay, perfect. Yeah, well done. Great job. Thank you for being part of the Voice of Healthcare Summit with us. So I wanted to ask you, because you were sort of recounting the different ways that you use voice throughout your practice. So my experience with the dentist, for me and my son, and you know, my wife is the same way, but it's the worst for me. So I'll go get my checkup, you know, do my thing. A lot of times my son will come with me, and we'll sit there, we'll pay the copay, whatever, but it's that moment where I get the piece of paper that says when my appointment is next time. That piece of paper is gone within the first 5 minutes of when I get in the car. Never found again. Yes. And then it's about a month later, I realize I don't know when my next appointment is, and far worse, I don't know when my son's is. So I then have to call them. Is there any hope for tying in the appointment making process in the back end office admin into voice? What are your thoughts on that?
I think that we're, you know, right now it's a little early in terms of voice because of HIPAA, for HIPAA reasons. And I think also from the patient perspective is what I worry about more than anything right now in terms of voice assistance. When you talk to patients, they're concerned about the initiation that occurs with a voice assistant and it picking up information that they don't want it to pick up. So we have found that we can use it in a limited capacity, but it's been very profound in its effect. I will say that in our office, we actually don't give any patient reminders. We actually always text the patient the information on an ongoing basis in terms of their appointments. And I think effectively, this is going to really be the future where patients are just getting their information digitally. They're not going to necessarily be receiving any paper reminders. But it's a good point that you raised, because I would love to see us get to a point, and it's just a bit early, but I think that all of us are concerned about privacy until we're not, so it's an issue until it actually helps us, or, all of your friends are doing something to incorporate it. So I'm pretty excited about hopefully in the future that's something that patients will be open to. And I think that's really the challenge, is patients being open to it.
We got a couple of other questions as well, if you don't mind taking a couple of questions here at the end. Another question that came in was about privacy, and if you've had any patients, you've got voice deployed in a couple different areas, obviously with Alexa and Google Assistant and Siri and what all, privacy has been a concern that's been raised over and over again. Have you had any patients push back at all, saying, it's cool that this is in your office, I like it, but did you think about that? Have you gotten any pushback from patients, new or old patients, on using it?
So I would say that the things that people have an issue with tend to be like my friends when I talk to them and I tell them how I'm incorporating it. I haven't had patients ever say anything, but I'll be honest, we really, we talk to patients about how we're incorporating voice, but they never really see it. So unless it's on their phone and they're initiating it, or if we're talking to them about how we've improved things in the office, but we don't necessarily have an Alexa device sitting in patient view, because we're concerned that a patient's going to question us about it initiating at the wrong time. So we really give it in the patient's prerogative to pick up their phone and then decide, okay, I'm going to use this and I'm going to use it to learn more about the office or learn more about a root canal. And them making the decision, then I can say that I'm absolved of any responsibility on that side.
That's interesting. This question was asked as well, but I'm going to phrase it in a little bit different of a way. So what we've seen with the pandemic has been an acceleration of, in many ways, personally, professionally, the acceleration of trends that had already started beforehand. So, if a business was on the margins beforehand, a restaurant, a hotel, that business is probably gone. Things that we wished that businesses would do for us are now here. Many more businesses delivering at home. I could go on and on and on, across different verticals. With you were so quick when voice, you've been using voice for a while. You were an early adopter of Alexa, creating skills and incorporating that into your practice. With some of the things that we've seen over the course of 2020 so far, what are your thoughts on the next step for voice? What are the particular things you have your eye on as maybe the next step for you in your roadmap for how you implement voice into your practice?
That's a great question, because I feel that that's the challenge, right? So like when I was bringing up the inventory example, you can use it only up to, the vendors are willing to work with you. And if they have an issue with, let's say, Alexa, now you're having to create, a private software to be able to, do inventory. And so I think it really is going to move more away from Alexa, using an Alexa device, and it's going to be companies developing voice to text software. It's just going to be outside of the voice assistants, in my opinion. I don't know that we're going to be able to move around some of the challenges I've been facing. And the reason why I've incorporated Alexa is because I'm all about personal branding. And it's important to me to bring everything in one place. And so that's why I brought the aesthetic dental skill as well as the personal branding skill on Alexa. But I also see the limitations that I'm facing and the challenges and the patient optics. And that's actually always a concern for me because those are my customers. And so I would say it's going to be more privatized voice, and it's going to be about meeting situations, particularly like dictation. I know you're going to have a speaker today talking about that, but I really think that incorporating, being able to transcribe notes is going to be a game changer within our healthcare system, because right now it takes so much time dealing with electronic records. And I think doctors or dentists feel like they're being pushed against the wall because their time is limited. More and more time is being taken away from seeing patients than actually doing, what they really want to spend their time on, which is patient care. And they're doing all their, extra time on note taking. So I really feel like it's going to be privatized. We're going to be spending more time on note taking. And it's going to be about doctors making sure that they try to save as much time with the resources that they use, whether it's technology in voice or any other type of technology.
I've got one more question for you. This is just my personal question from seeing your talk. You got my curiosity. So one of your slides dealt specifically with your inventory management at your practice and how you've incorporated voice into that process. And there's a company that we work with separately that has created a voice solution for inventory management in restaurants and in bars, keeping up with alcohol and things like that, stuff that has a funny way of walking off and a funny way of not of getting depleted and no one knows where it went.
Right.
So my question for you, seeing what's going on with this other company in this other sector, have you had any interest or any feedback from colleagues in the medical realm or in the dentistry realm on spinning that off as a separate business, however it is that you're roping in voice to that? Other people coming to you saying, please come over here and do that for me. I would think that'd be the initial response when dentists see what you've done with that and what have to be the obvious cost savings in terms of the time not being spent. What's been the feedback? Have you had to beat people off with a stick saying, stop asking me, I'm not in that business?
Yeah, I tend to, actually, this is the question you raise is something that I'm trying to overcome, is that challenge and that obstacle of trying to incorporate voice for inventory management. It's needed. There's obstacles in terms of how to set it up. And I've attempted to already contact different companies to try to do this on my own. And the obstacles really stem from, how are you going to divide up in terms of the inventory, in terms of who's going to get paid, and what system are you going to use to develop the inventory system? So the concern is that we have to, within our industry, make sure that the materials that we're using are obviously not gray market materials. And so there's a lot of interest in making sure that we only work with certain people in terms of the supply warehouses to develop the products that we use. So we only have like a limited number of people, and they already have their system that's working, and trying to convince them that this would be a better alternative is a little bit of the hiccup, because they are concerned about losing part of their margin using a system where they could possibly just do it continuously how they have it with their software. Secondly, I think some of the software that some of the bigger companies are using already dictate, for instance, expiration dates. It already tells an office how low they are on their inventory, and it tells them what are the products that they regularly use. And so they're giving a lot of data with their software that they feel, why should I move to another system? And so the challenge is really convincing these supply warehouses. I think it's close, but it's just, if you've already been doing it with the restaurants, I'd love to learn more about that, because it would be great to incorporate that within the healthcare. I think it's needed. I mean, we need to reduce our overhead, and that's one of the biggest problems is with the supplies.
Yeah, no, and I certainly can make that connection. It's just it's interesting just because what you presented on that slide, just seeing what I'm seeing in other industries. Shoot, the more you iterate on that, and the more that you incorporate that into your practice, that's profound, as well as many other things you said. Dr. Durgam, thank you for being part of the Voice of Healthcare
Thank you,
Summit.
Bradley.
Yeah, we
I
appreciate you.
appreciate
Great
it.
job. And I'm going to return you back.